Hi, my name is Julie Vargas and I will be sharing a video tutorial on the use of water treadmill for horses. I have no conflicts of interest to declare. Aquatic exercise is a well-established rehabilitation tool in human medicine. The physical properties of water such as buoyancy, viscosity, resistance, and hydrostatic pressure offer unique benefits during a training session. As the water treadmill becomes more widely used for both fitness and rehabilitation of the equine athlete, it is important that equine veterinarians understand basic principles of use. Unfortunately, research on water treadmill exercise for specific conditions remains limited. Therefore, it is essential to understand the general principles of its application so that each case can be customized.
There are many indications for water treadmill use. This exercise may be included in a fitness program for an elite athlete or weight loss for an obese patient. In 2013, King et al. Performed a randomized control study using the widely accepted carpal chip model for inducing carpal joint osteoarthritis and provided evidence that water treadmill exercise significantly improves postural stability. A continuation of King's study found return to baseline values for carpal joint flexion, restoration of neuromuscular patterns, and improvement in synovial membrane integrity.
Water treadmills come in different configurations, so an important question to ask a facility is whether the water treadmill is in-ground or above ground. Typically, in-ground water treadmill systems do not allow water level changes, and it is important to ask what level the system is set to. Above-ground water treadmill systems allow for water levels to be altered throughout the training session. Programs should be customized to each horse's fitness level and take into consideration injuries past and present. Variables such as water level, speed, and duration should be considered at each interval. Some water treadmills have the ability to add an incline, although kinematics under these conditions have not yet been studied.
Like any new exercise form, there is a period where the horse is learning to accept the equipment and habituation to the process and the equipment. This requires adaptation physically and mentally. At our facility, detomidine at 0.005 milligram per kilogram dosing is often administered for the first training session, and potentially more if needed. Safety for handlers and horses should be the number one consideration for the first several training sessions. With respect to physiological variables, in 2010, Scott et al. Published that a minimum of 2 15-minute sessions were needed to achieve a steady-state heart rate in horses walking on a water treadmill. They found that stride variability should even out after the first 3 sessions. It is worth noting that all physiological measures to date, such as heart rate and blood lactate levels, support that the fact that water treadmill work is an aerobic form of exercise.
To develop an evidence-based water treadmill program, it is important to recognize work done on limb kinematics in the water treadmill. Kinematic analysis performed by Jose Mendez Angulo at the University of Minnesota showed that walking horses in any depth of water, fetlock, tarsus, or stifle, resulted in a significant increase in maximal flexion and overall range of motion in all joints compared to walking with no water. When comparing water at the level of the fetlock, tarsus, and stifle, the greatest flexion and range of motion of the fetlocks in the front and hind limbs was achieved with fetlock and tarsal levels of water. The greatest range of motion of the carpus was achieved with water at the level of the tarsus. The greatest flexion of the tarsus was achieved with water set at the level of the stifle. Water treadmill is an excellent tool to consider when trying to achieve fitness without the weight of a rider or when rehabbing dorsal spinous process pathology. Although the back should not be considered as a singular unit, the thoracic and lumbar spine react differently to increasing water levels. In the cranial thoracic spine, extension increases with increasing water depth, while in the caudal lumbar spine, flexion increases with increasing depth. Horses with sacroiliac pain may find mid-level water difficult to navigate, as axial rotation around the craniocaudal axis will be greatest at carpal depth water.
Additional tips to keep in mind when designing a water treadmill program is that thanks to buoyancy, as water depth increases, concussion on the limb is reduced. As far as equivalent training, consider water treadmill exercise similar to a challenging ground schooling session. And lastly, recognize that increasing the water depth has a greater impact on the workload than increasing the walking speed.
In conclusion, it is important to note that under the wrong circumstances, water treadmill can induce fatigue and eventual overuse injury. The importance of collaborative support for the patient cannot be overstressed. Regular check-ins and observation during water treadmill exercise is imperative, as ultimately the best combination of speed and water depth will vary greatly between horses and should be judged according to the individual horse's response in terms of gait pattern and posture. Frequent adjustments will likely be needed over the course of rehabilitation, and until additional data and guidelines become available, the entire rehab team and veterinarian must work together to develop the most comprehensive plan, applying water treadmill in a scientific and clinically reasonable manner.